Hello, everyone. Just popping in to let you know that we will get started here really soon. I'm just going to give everyone a couple more minutes to log on and get themselves situated, and then we will dive into the webinar. Thank you, everyone who's already here. I'm excited to chat with y'all. So I'll pop back on in just a couple minutes as we have some more people trickle on here. Okay, everyone, we're about to get started. I'm hoping everybody can hear me. If there's any issues, then please don't hesitate to use this little chat box here. Let us know if there's, we have any technical malfunctions or anything like that. And then at the end, we'll do a little bit of time for questions. So if you have some, save them till the end and I will be sure to answer those. Okay, well, first of all, welcome. My name is Cara Slater. I am a physician here at Desert Wellness Center, and I get to talk to you today about my very favorite subject of all, which is hormones. I love hormones. This is 90% of what I do in my practice, and the reason I love them is because hormones literally affect every single cell in our body at every single stage in our life, from conception to the very, very end. So I preface this with that I see both men and women for hormone stuff, and we're going to talk about things for both men and women. But I did put a lot of information here for women, particularly because I think that we oftentimes don't get to talk about our hormone needs quite as much. And we've got lots of different things that we need. So I recently read that there was a statistic that said approximately 80% of women suffer from hormone imbalances. That's huge. That's 8 out of 10 women have hormone imbalances and are not feeling their best. And there's something we can do about it. We can get you feeling your best and get to the root cause and balance those hormones. So what does hormone imbalance look like? And this is a small smidgen of what people experience. And I'm hoping that you all are going to, be able to relate to some of these. And there might even be more things. We are finding out every day more and more about what hormones do. But what I see probably every single day in my practice is people coming in and feeling brain fog, decreased focus, sleep changes, insomnia, waking at 3 o'clock in the morning and being up for 2 hours, not getting back to sleep, a decrease in vitality overall. not feeling like you have that motivation to get into the gym, just feeling like you're just kind of a little more sluggish throughout the day, loss of muscle mass, increased belly fat. I can't tell you how often I have people come in and say, I haven't changed anything. I'm still working out exactly how I did. I am still eating my same diet. And all of a sudden, I have gained this 10-pound kind of pouch all in my midsection. And what is happening? And I'm here to tell you, hormones are a big part of that. Joint pain, mood stuff, depression, anxiety, huge. Oftentimes when we go through changes in our lives of like hormone changes, we can experience some big mood changes. Skin laxity, right? All of a sudden you're looking like, I just feel like my skin is so much more crepey. I'm having a lot more dryness. I think we oftentimes think of hormones and acne, right? Like when we're teenagers, but knowing that there's other points in our lives where we have changes. When we're reaching menopause and all of a sudden we have a drop in our hormones, our skin changes. And yes, we can get your skin back to feeling better. Vaginal dryness, libido. This is huge. We don't talk about this enough. And people just think it's like normal to just have a big decline. But a change in libido is hugely hormonally related. And then obviously changes in menstrual cycle, things like that. So if you can relate to any of these, then you're in the right place. So the other piece that's kind of the hidden underlying stuff that I really like to remind my patients about is that chronic diseases are really affected by low hormones as well. So this is particularly important for those of us who are in perimenopause and menopausal age, when our hormones are declining. And we know that these may not be things, you may not see osteoporosis in your 40s and 50s, some people might, or even 60s, but by 70s and 80s, this is a huge concern. People fracture a hip, and that can be a really big life event. Cardiovascular disease, dementia and Alzheimer's. We don't have great treatments for these things. It's all about prevention. And you know what? Hormones are key in preventing these. So for women, estrogen has been shown to be profoundly helpful in keeping our bone mass. It helps with our turning over of our bones, basically keeping them nice and strong. Cardiovascular disease. So for an example, when women reach menopausal age and basically our hormones decline, we then catch up to men as far as our risk for cardiovascular incidences. And in some areas, we actually exceed them. And this is because we have lost our estrogen. And if we can balance those hormones, bring back in some estrogen if it's necessary, then we can bring back down your cardiovascular risk and keep you, healthy, and we're preventing disease. And then obviously dementia and Alzheimer's. I think this is a big concern for a lot of us because once we're there, it's hard to go back. But this is a big key in preventing it. We have a lot of hormone receptors in our brain. And so if we can keep your hormones feeling good, that's going to help to keep all of those neural pathways tip top and your cognition really good throughout your lifespan. And I know for me, that's a big concern of mine. I don't want to be feeling really healthy and, not on any medications, but I don't remember my family, right? So these are kind of those underlying pieces that even if you maybe don't have some of the symptoms of hormone imbalance, these are really key to preventing future chronic diseases. Okay, so there was recently an article in the New York Times, which was really exciting because I think we're starting to talk about this a lot more, about hormone replacement and the importance of listening to women and what women are experiencing in our menopausal years. So has anyone ever been told, well, your labs are normal. So you come in and you're complaining of, I'm feeling depressed. I've gained a lot of weight. I'm having hot flashes and night sweats all night. And you get your labs drawn, like, well, your labs are normal, so you're okay. Or this is just a normal part of aging and there's really nothing wrong with you. Okay, guys, I have people tell me that on a daily basis when they come in looking for some solutions, because just because your labs are normal does not mean that you feel your best or you're optimal. And I want you to feel your best. The other piece is that oftentimes you're given an antidepressant, or here, let's put you on some birth control. You're 50. Okay. That'll just help balance your hormones. Well, what if the root cause is not an antidepressant? Not that you're depressed, it's that your hormones have changed or that you need to be on a birth control. And remember that a lot of these medications that are often prescribed to mitigate the symptoms that you're feeling, they've got side effects on their own. Oftentimes weight gain, they can hugely affect libido. So antidepressants, they're important when needed, right? But if it's not an antidepressant problem, that can lower your libido even more. And that doesn't feel good either. They also deplete nutrients. So it's not really the answer. I thought that this was kind of an interesting way to look at it, is saying, are we deficient in antidepressants for mood? Are we deficient in Ambien for sleep? Are we deficient in Adderall for our inability to concentrate? Or is it a hormone imbalance? Are we deficient in our estrogen or progesterone, our testosterone, or maybe your cortisol is out of whack, or your thyroid is low, and you truly are low in these and you need them? Nobody is deficient in Ambien. We just need to improve your sleep, right? So my goal is to get you rebalanced and get to the root cause. Because if we heal the root cause, we're just bringing you back up to where your level should be, what your body is used to having, and get you back to feeling like yourself, on top of preventing diseases later and preventing some of the side effects that these medications can have. And not saying that these medications are not necessary at times, but knowing that if it's not just a deficiency of Ambien for your sleep, that if we get your hormones balanced, you sleep like a baby, that's going to be much healthier in the long run for you. Okay, so let's talk about menopause and what a lot of women experience. So in menopause, frequently women have a lot of dryness overall. Dry eyes, dry skin, vaginal dryness, hot flashes, night sweats, weight gain, hair loss. I see hair loss all the time. A decrease in libido. We've got bone loss, like I was talking about with that osteoporosis, memory issues, the brain fog. All of these very common classic menopausal symptoms. But I like to remind people too that we're very aware of menopause, right? Okay, I stopped having my period, like I'm there. What about this forgotten stage of the perimenopause, when maybe we're still having cycles? Maybe they're a little bit irregular. Maybe they're still regular, but our hormones have changed. And this can be anywhere from 30s to 50s. And this is where we might experience some period changes. You might start having some hot flashes or night sweats. You might start having mood changes. You might feel like your libido is in the tank, or weight changes. This, just because you're still having your period, doesn't mean that we can't address your hormones. And I think this is oftentimes overlooked, and we're kind of in this forgotten stage. I myself am right in this stage, and I know that it can feel really disempowering when people are like, well, there's nothing wrong with you, and there's still so much we can do. There's never a time in your life where it's normal to feel crappy. Okay. So I don't ever want you not feeling your best. All right. So let's talk about men, because I think we talk a lot about women with, entering into menopause, stuff like that. But men go through andropause. And as this photo shows you, men in 20s, they've got all the testosterone, feeling good. Starts to decline in 30s, 40s. By 50, we've got half the amount of testosterone that we used to have. And then it just keeps going down from there. And we're actually seeing these levels go down even earlier. It's trending that we're having lower testosterone levels in younger men. And testosterone is so important for men to feel good, for mood, for libido, for activity, and also for preventing, chronic diseases. It's important for their bones, stuff like that. So men also need to have their hormones checked and be looking at, do we need to replace hormones for them as well? So let's talk about what estrogen does. So estrogen, both men and women have it, but it's much more predominant in women. So basically estrogen is going to decrease our visceral fat. So it actually helps us to not hold on to that kind of midsection weight. So when we have a big change in our hormones or a big drop in our estrogen, oftentimes we're like, oh my gosh, I've got this little midsection weight that I never had. Well, that could be related to low estrogen levels. Cognitive decline, so brain stuff, we have a ton of estrogen receptors in our brain. And when we get those levels down, you might be like, oh my gosh, I cannot remember these words like I used to. My to-do list, if I don't write it down, it is gone. Anxiety and depression, hair growth, right? So oftentimes we're like, my hair is feeling really thin. It's also breast protective. And then another piece I think is often overlooked, but is very important to me and probably to most of you, is skin. So estrogen actually improves our elasticity in our skin and helps us to build our collagen. So if we keep your hormones balanced, you will have much more youthful skin, and it really keeps that texture nice. Obviously, it's important for our menstrual cycle and our reproductive health, but it also is important for preventing plaque buildup for cardiovascular disease. It helps to regulate our cholesterol. I see women's cholesterol oftentimes go shooting up. We reach menopause and it's like, wait, I didn't change anything, but my cholesterol levels went up. It might be because of your hormones, and we get those balanced and we bring them right down. It also helps us maintain our body temperature, which in turn makes sense when you're having hot flashes and night sweats. Well, we don't have any estrogen there to help maintain that body temperature, right? Okay, then we've got our progesterone. Also, both men and women have this, but women have this predominantly, and this really comes in the second half of our cycle. But what it does is it's very calming. So like progesterone is like your natural, I want to say like natural Xanax, but obviously it's not like it's that strong, but it's really what is like calm. It helps us to sleep. It can reduce our anxiety. It can be helpful in reducing PMS symptoms. It supports it also supports our bone density. It can be helpful for our breast health as well. And obviously it's really important during pregnancy and after childbirth. It drops. So these things can also play a role in postpartum depression, stuff like that. But it's also really important for anti-inflammatory immune system stuff. So progesterone is also hugely important throughout our body. But let's talk about testosterone. I feel like testosterone is one of the most overlooked hormones for women. And you might be surprised to know that it is the most abundant active hormone in both men and women. So we have testosterone is our most abundant hormone, but I feel like we talk about it so rarely as it's important for women. But it is hugely important. It's important for brain function, right? That brain fog can also be really triggered by our testosterone. Energy and motivation, waking between 2 to 4 a.m. Oftentimes we get your testosterone balanced. You're like, oh my gosh, I'm sleeping through the night. That's amazing. It blocks inflammation. It improves our blood flow. Low testosterone is also associated with higher cortisol levels. And if we're thinking cortisol, we're talking kind of stress stuff. So, if you got some stress in your life, which, welcome to the club, testosterone is really important for helping us to kind of make it through those stressful times. And our body actually oftentimes pulls a little bit more of our hormones during stress. So if you've gone through a stressful time, you might have even lower amounts of hormones because your body was trying to use all it could. It's important also for our skin health, getting our red blood cells together, and it's huge for libido. So I want to make sure we touch on libido because I feel like this is something that I hear people talk about every day in my office, and maybe some people are, shy to say, gosh, I just am not, my libido has tanked, or I'm having difficulty climaxing, things like that. Testosterone is really important for that. So women need this too. And also I will just say it also is important for kind of where we're storing our fat. So for both women and men, when we start to store it around our midsection, testosterone kind of tells our body, let's not store it right in our midsection. Let's store it other places. And maybe let's build a little more muscle. So important and really important hormone for both men and women. So I'm doing all this talking about hormones, and how do we balance your hormones and how do we bring hormones in? So first of all, everyone is unique, and kind of depending where you are in your stage of life or what your concerns are, there might be different approaches. So sometimes, we're just doing some herbal support, we're doing dietary changes, but oftentimes we are bringing in some hormones to help your body function properly. And all hormones are not created equal, and all methods of giving hormones are also not created equal. So synthetic hormones are those which are, I would say, kind of the old school. We don't use those anymore. Actually, people do, but we don't here. So this would be things like Premarin. Premarin is an estrogen that was actually, it's a horse estrogen. It's made from horse urine. It's not bioidentical. That means it is not the same as what your body would produce. That's what a horse's body would produce. You might get some of the effects of what you might feel, but it's not identical. And then progestin. So progesterone is what our body makes. Progestin is the synthetic form, and it is not the same, and it has different side effects. And we're not giving you the progestin. This is what's found in like birth controls and things like that. So the way I kind of like to give this example to you guys is that basically when we're using these synthetic hormones, the key looks the same, but it won't fit in the door and open it. It also can increase your risk for breast cancers. This is where we get a lot of those studies that said, oh my gosh, hormones cause cancer. Well, this was for the synthetic versions, not the bioidentical. And it can also increase risk of heart disease and Alzheimer's. Now, bioidentical hormones, on the other hand, these are exactly the same molecules as what your body would naturally be making. So your body knows exactly what to do with these. And they don't have the harmful side effects when they're well managed by a well-trained provider, because like I said, it's not all equal. You can get, you have to get the right dosing and, find a provider who's really well-versed in this, which every single physician at Desert Wellness Center is experts in hormone balance. So what's my favorite way to bring in hormones? That is pellets. So the reason I like them is that it really most closely resembles what your body does naturally. That means that you're getting it 24 hours a day. So unlike something where, you're applying a cream once a day, or you're, taking a little pill or something like that, you're getting a surge, right? This is in your body. You're getting it 24 hours a day. You can pull from it when you need it. So you're doing some exercise and your body's like, oh, we need a little bit more hormones. Great, it's there. And then you're sleeping and it's like, oh, we don't need it as much. And it's always a bioidentical. There's no other, additive in it. So if you're doing testosterone injections, it has to be attached to a little molecule. This one, you're just getting your hormones, which is what our bodies are used to, right? So let me tell you kind of what pellets do. So I myself get pellets, and 90% of my patients get pellets. Basically what we do is you can see these little size of kind of like a grain of rice pellet, and we just pop them below the skin. I insert them, and then we do a little steri strip, no stitches or anything, you're covered up, and then your body makes blood flow go to these, and it starts to get into your blood system. And after about 2 to 4 weeks, you kind of reach your peak level, and then it really stays very balanced for the next 3 to 5 months. And that depends on whether you're a man, whether you're a woman, and your dosing, but it's a nice balanced release of that hormone. Then you come in for your next pellet in the next 3 to 5 months. So like I said, this is my favorite. However, there are other options, things like creams, lozenges, patches, injectables, and everybody, it's an individual, talk between you and your doctor, but everything is going to be bioidentical, the safest, most effective dose for you and getting you feeling good. So we kind of went over a lot of things. I want to open it up for some questions, and then we can hopefully have a little conversation about anything that was covered that you guys are curious about. But I'm going to open the floor to you guys right now. So yes, I got a question here. Is testosterone available as pellets? Yes, it is. So great question. And let me expand on that because I think I might have glossed over it more quickly. We have pellets for both testosterone and estrogen. So I give both women and men testosterone pellets all the time. And most of my women will probably get a little bit of estrogen and a little bit of testosterone. So yes, pellets are available as testosterone. My men love them. I think it's so much easier. A lot of men come into me either on nothing or have been on injectables or have heard about injectables. So, then yeah, next visit, I love it. Pellets are my favorite. And also for my men who do injectables, if you're kind of tired of having to poke yourself every week, you guys get to go every 5 months and then come in for your pellet. So it's so low maintenance. You just come in, get your pellet, and then I'm like, I'll see you in 5 months, and you go about your day and you don't have to think about it and you have your testosterone. I got another question here of what is the price for the pellets? So pellets for females are $3.50 each time you come in. And that is going to be about every 3.5 to 4 months. It does not change depending on your dosage, which is really nice, so that as your body changes and you need more of this, or you need less of this, your price is always the same. For men, it is $7.50, and you're coming in every 5 to 6 months. And once again, not dose dependent for those costs. Okay, and then next one, how do you test hormones and how often do you repeat? Great question. So everybody's going to be a little bit different, but at your first visit, we're going to gather your history and get your labs and see where your numbers are. Then, if you got pellets, for instance, we would do your pellet insert, and then 6 weeks later, we're going to retest your blood. And all of the testing that I do is blood work. And that makes it easy for you to use your insurance if it covers it. We also have cash pay labs, and you can get your blood drawn in the office here, which we wanted to make it as convenient as possible. So 6 weeks after your pellet, you get your blood drawn to check those hormone levels. And that's where we're checking to see, how are you feeling? And did our numbers improve? Are we right where we want to be? And if so, great. Then you go about your business, and I want to check them probably every 6 months or so. If we need to tweak things at all, that 6 week mark after your first pellet is a good time for us to readjust if we needed to, if we had to add a little bit more in your pellet, anything like that. So hopefully that answered question for the labs. And then Lexi, are all hormones available for pellets? So pellets are available in testosterone and estrogen. For women, when you are taking 99% of women, if you are on estrogen, you also need to be taking some progesterone as well. Progesterone is not available in a pellet. That's just not how it works. So for progesterone, I oftentimes will give a capsule, which is easy peasy, can go to a normal pharmacy, or I will sometimes give troches or creams. There's lots of different ways, but progesterone is not available as a pellet, but the testosterone and estrogen are. Okay, the next question, can you use pellets if on levothyroxine, or does it depend on the reason for the levo? No, you can absolutely use it if you're on levothyroxine. I have tons of patients on thyroid hormones, whatever it might be. And so the wonderful thing about pellets and bioidentical hormone replacement is that we're just giving you what your body would have been making. So it's not the synthetic version. So therefore, it's really not going to interact with most things because it's not a separate medication, right? Obviously, everybody's case is individualized, so I never say never. But in general, it's something your body would make anyway. So it's not going to interact with other medications. So you can totally take it. Absolutely, thyroid medication is totally fine. Okay, and then I have another question. What is the best way to change from testosterone troches to pellet? And can you take troches for the first few weeks after placement, or do you just stop? Great, great, great question. So you come into the office and you talk with your provider and they can switch you to pellets. There's not really a timeline. And yes, you oftentimes can take your troche for the designated amount of time until that pellet is going to kick in. Really not too long. At the most, I would say a week. Until that pellet is in your bloodstream. But it's an easy switch. You just come in, we get the pellet inserted. Maybe you take your troches for a couple more days, and then you'll start feeling better, and you just stop taking the troches, and you're good to go. Okay, I've got another question here. Do you see a combination of needing hormones while also struggling with Hashimoto's? Yes, absolutely. So, when all of our hormones are kind of connected, and your thyroid is a hormone. So Hashimoto's, when we're talking about Hashimoto's, for those of you who are not aware, we're talking about autoimmune thyroid disease. And Hashimoto's oftentimes causes low thyroid symptoms. It can cause a lot of other things, but that's kind of what we're talking about. And when one area of our hormones is off, so for instance, your thyroid, that might mean that the other hormones have to work a little bit harder. So maybe your, estrogen and progesterone, or your cortisol, your adrenal hormones, they might be working overtime because your thyroid was, not working properly for a little while. And that might mean that you do need a little extra support because they might be a little bit lower. So I absolutely see people with Hashimoto's needing hormone therapy, but I would say I see it, throughout. Nearly anybody, whether you've got, another issue or not, can really benefit from hormones if they are indeed low. And a lot of us are low, myself included. So great question with the Hashimoto's. Yes, it can definitely be a very helpful additional piece to getting you feeling your best if you are treating your Hashimoto's. Okay, these were amazing questions. I really appreciate you guys being so engaged. It looks like that's most of them. If anyone has additional stuff, don't hesitate to reach out. And obviously, if you are already established in the practice, set up a time with your doctor. Oh, I've got one more question here. You mentioned hormone patches. Is that something a Desert Wellness Center uses? Absolutely. So every case is going to be individualized. And that's where having this conversation with your doctor, looking at your labs, your specific concerns, and then coming up with the plan that is going to be best suited for you as an individual. Because that may look very different from, John Doe over here and me over here and you here, and what's going to work best for you. But I definitely have some people on estrogen patches. So there's so many different ways to do this. And it's really individualized for what's going to feel best with you and that conversation with your doctor. Great question. Okay, so please feel free to, like I said, if you are already established and you're kind of like, I think I need a little hormone revamp, or you're wanting to, switch to pellets or anything like that, then reach out to us. Let us know. Give the office a call. The front desk staff is superb, and they will get you, in touch with or scheduled with the right person. If you're not established yet and you're wanting to become a patient, give us a call and we'll get you scheduled. And hopefully just get everybody feeling their best. I so appreciate your guys' time and all of your participation. And this was such a pleasure to be able to talk about my very favorite thing. So y'all have a wonderful rest of your week and enjoy this beautiful weather we're having. And we will see you guys around the office.